All right, welcome to Ask Nurse Natalie. This is Nurse Natalie. But before we get started, I promised in one of my videos that I would introduce Arlo. So we're going to have a little Arlo time. So Arlo, and this is his buddy Spot, are from one of my favorite movies, The Good Dinosaur. So I watched that movie the day I defended my senior thesis in college, and it was a stressful day, but I loved the movie, and so some of my very favorite people got me Arlo to remember that day and to remember a very successful thesis defense. So he's very special to me. The movie's very special to me, and I have a lot of Arlo, and if you haven't noticed already, dinosaur things in general. So Arlo is joining Nurse Natalie for a special time of Ask Nurse Natalie about COVID-19.
All right.
So
I'm ready for my questions.
all right, I'm going to go a little out of order.
Okay.
Because I think one's going to help us understand your expertise.
Right.
So, Natalie's my roommate. She was also my roommate all 4 years of college.
Wow.
We went to nursing school together.
Not really.
I was just there.
She was just there.
What kind of nurse are you, and what do you do at your work?
Okay. So I am an ER nurse. I've been there almost 4 years. I work in Dalton. Really, I do a little bit of everything. From broken arms to belly pain to strokes to heart attacks to more serious things. We see everything in the ER. I've gotten a lot of good experience over my time. A typical day, there truly is no typical day in the ER. It changes daily depending on where I'm working in the ER. But I give a lot of medicine, I start a lot of IVs, I do a lot of procedures, and I see a lot of different groups of people. I see young people, I see babies, I see really old people, I see middle age, just all populations. So there is really no typical day, but usually it's always somebody sick, always somebody that needs medicine and needs help. And so that's about it for me.
10 out of 10 would recommend living with an ER nurse.
Yeah.
All right. Oh, come here, Azalea.
Baby, come here. Azalea might join us.
She
Baby,
might.
come here.
All right, first question. Has hospital staff been tested yet?
No. We are not testing hospital staff at this point. We're very low on supplies. So we're really only testing people who are sick enough to stay in the hospital for whatever reason regarding their COVID-19 symptoms. So no, right now we just don't have enough supplies to test hospital staff. That might change, but for right now, no. The only way a hospital staff member would be tested is if they were sick enough to be admitted or sick enough to stay in the hospital overnight.
Is there any way to get rid of coronavirus that you know of?
No, there is no cure as of right now. It is a virus. It's not a bacterial infection. So antibiotics really aren't going to do anything for that. There are some preliminary trials out there with different antiviral medications and in combination with some antibiotics. But as of right now, there is no definitive cure for this.
And with some of those learning blades with the nurse, it talks about how antibiotics work. So that's something we're going to learn more about a little bit later.
Baby.
Azalea, come here. A little bit later down the road. What causes coronavirus?
Okay, so oh no, my battery's low.
Where's the charger? New answer.
It's on my bed. So, what was the question?
What causes corona?
What causes? Okay, so the coronavirus originated in Wuhan, China, and that's just a province within China. And although there's not like a definitive, Azalea's here, a definitive like answer here, it's thought that it originated in some kind of like fish or food market there, because the coronavirus is in animals and can be spread to humans, and in some manner, don't know how, it was spread there to a patient, a human, and then it just went from there. So that's where it is originated from. The specifics on that, I don't really know, but that's what they think at this point where it started. Is there any more to that question? Okay.
I hope you are all enjoying a glimpse into our life here. And I think that your answer segues really well into the next question, which is important and near and dear to our hearts. Can dogs get the coronavirus?
As far as we know, they can't. There have been mixed messages with that, just because it is so unknown.
Azalea.
Azalea.
You're safe,
What are
baby.
you seeing?
Come here. Come here.
Here, you want to grab her?
Yeah.
Come here.
Oh.
She got it. So no, we don't think that they can. There's still a lot of uncertainty around this disease, and that could change. But for right now, we don't think animals, dogs, in this answer, can get it.
I lost her toy. All right, so next question. I think this one's also very kind. Will the summer allow the coronavirus to go down? I hope Nurse Natalie and Miss Ellington have a nice break and have fun.
There is talk that it will decrease as the temperatures warm up because that is how the flu is. Flu season is from October to April. By April, it's assumed that it is warmer and that the flu cases are drastically decreased. Originally, it was said that the coronavirus is very similar to the flu and how it spreads its symptoms. But now that we've got a little bit more research out there, I'm not so sure of that. I hope that it will decrease as it gets warmer, but there's no definitive answer on if the summer would kind of lessen all of the cases. I'm hoping that with social distancing practices and quarantining that it will be much lower in prevalence by the summer, but we don't know for sure at this point.
And we're always going to have fun, so don't you worry about that. Been watching a lot of Disney Plus. If you have coronavirus, how long does it take to go away?
Okay, so that is something that I looked up on the CDC's website because
Can you tell us what the CDC is?
Centers for Disease Control. The headquarters are in Atlanta. They are pretty much the sounding body for any kind of infectious disease in America, and the world kind of follows these guidelines as well. But they are the ones that a lot of governing officials and governing bodies are going by. Their recommendations. So I just pulled up their website. It is a government organization. So it says people with COVID-19 who have stayed at home, who can stop home isolation. So most healthcare centers are recommending that you be tested again when you don't have symptoms to make sure that you are no longer infected. So this is giving two options. The first option is if you will not be able to be tested. So say you've been diagnosed, you've tested positive, but you no longer have symptoms. You want to know if you are okay to go back outside. It says you can leave home after these three things have happened. You have had no fever for at least 72 hours, which is 3 days, 3 full days with no fever without the use of medicine that reduces fevers. So that's one. Second thing, other symptoms have improved, so cough, shortness of breath have improved, and at least 7 days have passed since your symptoms first appeared. So those are the three things if you're unable to get a test done. If you are able to get a test done, determine if you are still contagious, still 3 things. You no longer have a fever without the use of medicine. No other symptoms have improved, like I said, and you have received 2 tests in a row that were negative that were 24 hours apart. So the first 2 are the same. You don't have a fever, your symptoms are better. But the change is if you are able to get tested again, you need 2 negative results 24 hours apart.
Okay. Sorry, Azalea just really wants to play now that we've both decided to sit down and do this. Can it affect younger people?
Yes, absolutely. It can affect any age, any population. And we are seeing more cases in older people, which I'm sure you've probably heard that, but there are younger people who are exhibiting symptoms. They might be less severe than someone that is old, but yes, it does affect young people.
Okay, so that also, somebody else asked a similar thing, and you kind of talked about how coronavirus started already in another question. When you get the coronavirus in your house, what do you do, especially if you have family? So, for example, if I were to get it in our apartment, what are some things that we would do?
So, obviously, anybody in your household that has been exposed to somebody who's positive needs to self-quarantine, which means just don't go outside. Don't expose yourself to any other people. It's pretty much assumed that if, say your mom were to test positive for COVID-19, that you have been exposed and very well could have it. I'm not saying you do, but possible. And therefore, you would want to self-quarantine. You would want to stay home with your family, all of the people who have been exposed, and follow the guidelines that I just read about, if you're contagious anymore. But the biggest thing is to self-quarantine. It doesn't mean stay in your room and don't see your family that you live with. It just means stay at home and don't go out unless you absolutely have to. I mean, even if you absolutely have to, see if someone else can go out for you. Since I'm exposed to so many sick patients at work, Mallory and Haley are going and getting groceries. I only, for the last week, I've only been at work in here. I've not gone anywhere else other than taking Azalea to the vet last week. Had to do that. But, because I recognize that I have a high risk of spreading the disease just because I have been around patients who probably are positive. So I'm just trying to distance myself from any other people. Other things you can do at home, wash your hands and clean, disinfect, and try to just be very mindful of your own room, your house. Make sure everything is clean and wipe down surfaces. If you cough in, and don't just cough out and spread all of those germs. If you're blowing your nose, throw that tissue away. Try to be as clean as you can. I think that's it. Be very mindful of what you're doing. I just touched my eye and I was like, I shouldn't have done that. Not touching your face, your nose, that sort of thing is also helpful. And also just washing your hands for at least 20 seconds or more,
So we've talked a lot about social distancing and quarantine. Can you tell us what those two are and what the difference between those two things are?
So part of social distancing, there's two different kind of points to this. If you have to be out, if you have to go to the grocery store, if you're Mallory and you're getting food for us.
Miss Ellington.
Miss Ellington. Stay 6 feet away from people. Obviously, we're not abiding by that because we live together. But at the checkout line for the grocery store, stay 6 feet back from that older lady who's in front of you, and be mindful of the surfaces you were touching when you do that. And also with social distancing, I'd like to hang out with other friends right now, but we are choosing not to. We had some friends that were supposed to come last weekend that did not because we were trying to be responsible and social distance, even though none of us are at a super high risk for this disease. I guess I technically kind of am because I'm exposed. No. We still wanted to be responsible in doing that. So if you see people who are hanging out with a couple friends, although that's less than 10 people, which is kind of the recommended thing, no greater groups of 10 right now, that still to me is not responsible. If you don't have to hang out with people right now, don't. Stay at home, stay with the people that you live with, and try to just find other things that you can do at home to keep yourself entertained.
Can I add something real quick? So some of you may live with 10 or more people.
And that happens.
And that happens.
Okay.
And that's different because it is your family and you are living with those people. So one of my best friends growing up, there were 12 kids in her family. So obviously, they have hit and surpassed the amount of people recommended. And I would say that's a little bit different because you were living with those people. But now's not the time to get 10 of your best friends over for a sleepover to do TikTok dances and watch Disney Plus.
Right. And then quarantining is where you are isolating you or your household and not going out to public places, to grocery stores, wherever that may be. Quarantining for someone who is positive looks a little bit different. If I were to test positive, I probably wouldn't necessarily sit out here on the couch all day. I would probably try to limit myself to my room, come out only when I really need to out here, just to limit my exposure to Mallory and Haley. But it's also kind of assumed that if I'm positive, there's a good chance Mallory and Haley might also be positive. So that is more of quarantining. It is more of an isolation than social distancing is.
Thank you. So we're all social distancing right now. Some of you might need to quarantine, and that's fine. But just want to be clear on our terms. What are the types of coronavirus?
So the coronavirus is not anything new. What is new is the strain that this is. This is COVID-2. Or Yeah, it's a new strain of the coronavirus. It's a different like RNA sequence, which is going to get real sciencey, but easy terms, this is a newer strain of COVID.
If you've seen on news, they'll call it a novel. So Novel, like we read a novel, but it also means new.
So the reason why we're having such a hard time maintaining this and treating this disease is that the RNA sequence, like behind this disease, our bodies don't know it. It's new. It's novel. So therefore, we as like healthcare professionals don't know how to treat it properly. And the older disease that's been around since like the 60s, we do know how to treat that one. So as far as I know, there's an older version that we are aware of and know how to treat, and this is a newer version. There could be other strains out there, and that is something I've heard that is very possible, that there are multiple different strains, but the one that we are dealing with that we just don't know how to treat is COVID-19. So I don't know if that answered that.
I mean, that makes sense to me.
Okay.
Natalie's much better at the science than I am, because it's been a long time since I've taken a science class. This question's more for me. I want to know how many more days we are not going to school because of the virus. So you should have received a calling post yesterday, and if you didn't, please email me or your homeroom teacher so that we can get you on calling post. We are following the governor's recommendation, and we will be out of school through the 24th, which means we will not be back at CGLA until April 27th. You can check the website for more information about that, or email me or any of your other teachers if you have a specific question. Right now, as schools, we are trying to listen to healthcare professionals and what they're saying and what they're recommending. And I know that the governor is as well, and that's how that decision was made. And again, any further communications like that are going to be sent through calling posts and put on the website. So please be looking there for that information. So I've had a few people ask about this, and I know that I'm touching my face a lot, and she just said, don't do that.
Our hands.
I'm going to wash my hands after this. Can you tell us what the symptoms are of coronavirus?
Okay, so the main symptoms are shortness of breath, fever, and cough. Those are pretty broad. I would say the more concerning of those are fever and shortness of breath. Unfortunately, this is allergy season, and some of us might have coughs right now. And more like upper respiratory symptoms that are runny nose, sore throat, congestion, sinus headaches. Those aren't necessarily symptoms that you would need to worry about, because a lot of us are probably experiencing those right now. What becomes concerning is fevers that even if you take Tylenol or ibuprofen, it's recommended to take Tylenol, but you still have a fever after taking those medications. You feel short of breath. Not like I just ran up some stairs short of breath, like sitting still, feeling like you can't catch your breath, and not being able to get any relief with that. And also a cough that you just cannot get rid of, even after taking like over-the-counter medications like Dayquil or anything that would help with a cough. Those are the symptoms that are most concerning right now. The more upper respiratory symptoms, like I talked about, really are not any indicators of the virus. But if you or a family member got to the point where you could not control the fever with medication, felt so short of breath, like you could not catch your breath, that's when you would want to go to the hospital to be checked out. There's no guarantee that you would be tested. Like I said, we are running very short on supplies. So really, at least where I work, you would not get tested unless you were sick enough to be admitted. Now, I know that some places are working to get more tests, and you very well could be tested with those symptoms. But right now, if you're experiencing like fever, shortness of breath, cough, that is manageable. I would recommend just self-quarantining, staying at home for 2 weeks once your symptoms start, to ensure that you don't infect anybody else.
Okay. Did you want to kind of answer that top one?
Yeah.
Okay, that's what I thought. So if a family member has COPD, and if you'll tell us what that is in a minute, and asthma, how can we keep them safe? Now, I also love this question because Miss Ellington has asthma, and so this is something Miss Ellington has had to think about. Oh, and Nurse Natalie also has asthma. So this is something that we are very familiar with. And when I started learning more about coronavirus, that was a concern I had, is how do I make sure that I also keep my asthma managed during this time?
So any family members with COPD, it's chronic obstructive pulmonary disease. Just
and what does that mean?
It means that they have some kind of lung problem. It could be chronic, which is like reoccurring all the time. Bronchitis, emphysema is also, like, if you've heard of those words, and asthma is included in that. So if you have a family member with any of those problems, the biggest thing is just to keep them safe, stay away from them if you don't live with them. If you do live with them, be mindful of, if you're coughing, cough away into, like, your shirt, a shoulder, whatever, into a tissue. Wash
you
your
should
hands.
always just cough away from people, too. Just people. Always, even after this, always cough away from people, please.
And make sure you keep things clean. You might end up going with a parent or something to pick up medications for someone that might have these problems. You want to limit their exposure and try to just be as clean and safe around them as you can. They very well may be fine during all of this, but they are at a little bit more risk because they already have some respiratory problems.
All right. I think this one's going to be harder to answer, but how long do you think this coronavirus is going to last?
I honestly have no idea. I think that we still have a little ways to go. I would say at least until April, which is not that far away. I think it'll be another couple weeks before we start seeing a turnaround in the U.S. I'm hoping that by Easter things are better. My plan personally is to stay at home and only go to home and work until Easter, which is April 12th. But it could get closer to that time, and it's still pretty severe here in the U.S., and I might have to stay home through the rest of April. I'm not sure. We don't know. The trajectory right now is that it could get worse before it gets better, but that just means to continue to stay safe, stay home, social distance, and just continue what we're already doing right now. So I don't know when this will end. Nobody does, but what I can say is just please, please, please stay at home and stay safe. Wash your hands. Biggest things.
All right, last question, which I feel like would also be a good question for Nathan. Do you think we'll find a cure?
I don't know. I know that there are a lot of people out there working on it right now. And I wouldn't necessarily say cure. I would just say treatment. I think that we will eventually find a treatment for this, just like the flu. The flu was very impactful when it first kind of came to be, but now we have medicine for it, and I think that we eventually will have medicine for this virus. I don't know if it can be cured, but I think that it will eventually be able to be treated.
So. Thanks, Nurse Natalie, and thank you all for hanging out with me and Arlo and Nurse Natalie. If you have more clarifying questions, feel free to put them in the comments, and I'll make sure
subscribe.
Or
check. Is it a check? I don't know. I don't know
YouTube. And I'll make sure that Nurse Natalie sees them, and I will get an answer to you. And maybe if we need to, we'll just do another video while we're here and while we're hanging out. But I hope you all are doing well and staying well. And in the last video, I said that a friend recommended I come up with a YouTube catchphrase, and I'm still working on that. So feel free to sound off in the comments. That's something I've heard on YouTube before. Sound off in the comments. But I hope you all are doing well, truly, truly. So have some fun today. Put on some Mickey Ears or another costume, because that's all we're doing here while we get our work done. But see you guys soon.